The following video shows a role play of our most common telemedicine use, a virtual clinic, where a nurse is with the patient while the doctor is connected by the telemedicine case. Here, the nurse is introducing himself to the patient and explaining how the teleconsultation will take place with the doctor who is not present with them. You can see the rugged telemedicine case, while the nurse is starting the virtual consult and introducing the patient and the remote doctor to each other. The doctor has asked that the digital camera system is used to look at the patient's arm. This may be because of information the nurse has previously communicated to the doctor via a questionnaire on the platform. The doctor is the one who guides the consultation so that he can get the information he needs to provide appropriate care to the patient. In this way, the nurse becomes the doctor's hands in the virtual consult. The nurse and the patient can also see the images for better understanding as the doctor explains and interprets what he is seeing. This camera has attachments for examining the ear, nose, throat, and skin, all in one system, and the settings can easily and conveniently be changed on the screen. One of the benefits of this consultation being virtual is that the doctor can easily capture the most relevant images for the clinical file. After the consultation, the doctor will have access to the high-resolution photos taken, not just screenshots. The doctor has now asked the nurse to check the patient's vital signs using the monitor, which is able to give spot readings for blood pressure, temperature, pulse, and SpO2. He starts with measuring blood pressure. We appreciate the understanding of any medical professionals watching, as the nurse in this video might not follow all the precise clinical steps. He's an engineer rather than a doctor. And rest assured, the individual playing the role of the patient is in perfect health. The Vitals device does its work and the results are streamed live onto the screen for both the nurse and the doctor to see. The tough and durable battery-powered case is really portable, whether by road or even on a plane, as our team has done recently. So it can deliver clinical services anywhere with an internet connection. You can use a SIM card for data, and where there is access to Starlink, one can connect from anywhere. Fortunately, based on the blood pressure reading, it looks like our patient isn't too stressed at work. The battery pack in the case will typically provide 8 to 10 hours of autonomy with all devices running. Some devices, like the stethoscope, take no power, and others have their own battery or pull from the device battery. The nurse explains the results of the blood pressure test to the patient before moving on to a temperature assessment. Finally, he places the clip on the patient's finger to measure SpO2. Once again, the result pulls through automatically to the screen for both the nurse and the doctor to see. Glucose monitoring will also be integrated into the platform soon. Our other product, Telemedicine, is used for remote auscultation or listening to heart, lung, or bowel sounds, and ensures that the sound that the doctor hears is exactly the same as if he was standing next to the patient, and that no data has been lost. For the doctor to check the patient's pulse, the nurse opens up Telemedicine inside the telemedicine platform. The screen has been designed with a graphic of the upper body, which makes the user experience very visual and intuitive. The platform has been built for guided placement. This allows the doctor, using his mouse, to pinpoint exactly where he would like the digital stethoscope to be placed. Whatever the doctor requests is what the nurse sees on this side. As you can see, there are also different settings for heart versus lungs, as well as the front and the back of the patient. The quality of the graph may vary slightly, reflecting the non-clinical setting of this demonstration and the patient's comfort during the recording. At the end of the consultation, the nurse and patient say goodbye to the doctor, and the nurse ends the teleconsultation. A full report of the consultation is available to download for the doctor as well as the nurse. This includes all measurement data, questionnaires, and information, or other files that were uploaded. The notes that the doctor made during the consultation are only included in the doctor's files and are not visible to the nurse or patient. In addition to the glucose monitoring that I mentioned, we will soon also be integrating a 12-lead ECG a spirometer, and a point-of-care ultrasound. We'd be delighted to explore how this innovative technology can be tailored and implemented to meet the needs of your organization. Let's connect and discuss the possibilities.